Bismillahirrahmanirrahim. My name is Dildar Hasan, first year student of Ocean Medical University. Today I am presenting the topic Basal Ganglia. Actually, it is misnomer. The structure which is present outside the central nervous system and the basal ganglia is present in the central nervous system. Telencephalon, dencephalon and the brainstem are its misnomer. Then we have components. It has 5 components: caudate nucleus, putamen, globus pallidus, subthalamic nucleus and substantia nigra. First of all, I will discuss about caudate nucleus. The part of the caudate nucleus: head, body and tail. Head is the lateral ventricle in Huntington disease. First I will discuss about caudate nucleus. The part of the caudate nucleus: head, body and tail. Head is the lateral ventricle in Huntington disease. There is the head of the caudate nucleus, dentation of the lateral ventricle, especially the interior part. And the tail attached with amygdala, and it is very helpful. Then it may change heart rate, blood pressure, and rate of respiration. Then we have Huntington disease. Many people develop with Huntington disease develop involuntary jerking, twitching movement known as chorea. Then we have affected individual. Affected individual may have trouble in walking, speaking, and swelling. Then we have St-Vitus-Dance disease. It is also known as St-Vitus-Dance. It is childhood disorder, inflammatory response to strep throat or rheumatic fever, involuntary movement of all muscles. Then we have gray matter. Between external and exchange capsule is called gray matter, and the structure between internal and external capsule is called lentiform nucleus. Putamen globus previous externum and the putamen globus previous internum called caudate nucleus. And the putamen called neostriatum. Then we have globus pallidus. Globus pallidus is divided into 2 parts, externum and internum. Then we have a thalamus. Thalamus is the ventrolateral nucleus and the interlaminar nucleus. And then we have subthalamus. Subthalamus release glutamate. And then we have a diagram in a basal ganglia. Basal ganglia, and this part is a thalamus, and this part is caudate nucleus. I already explained it. Caudate nucleus, putamen globus previous externum and putamen globus previous internum called caudate nucleus. And this part is a cortex, and these layers are also called as putamen. Then and the 2 layers are called substantia nigra and subthalamic nucleus. Then neostratum. Neostratum is made of the caudate nucleus and putamen. Caudate nucleus is a C-shaped gray matter nuclei. Head below the lateral horn and interior horn to the lateral ventricle. It is attached with amygdala and below to the inferior horn. Thanks for attention.
Bismillahirrahmanirrahim. Myself, Muhammad Afzal. I am the student of first year Ocean State Medical University. Today I am explaining the functions of basal ganglia. What is the function of basal ganglia? First of all, basal ganglia gets inputs from the cerebral cortex and give outputs to the cerebral cortex. This is the basic function of basal ganglia. Furthermore, if we go in brainstem, there is serotonergic fiber from the brain stem fibers go towards the striatum and then release an inhibitory hormone which is called serotonin. Furthermore, if we go to the corpus striatum, assist voluntary actions, movement, learning, motor skills, drawing, writing, singing, then talking. Furthermore, if we go, there is a term in disinhibition. What is disinhibition? Furthermore, I am explaining about disinhibition. If one group of inhibitory neurons, inhibits the other group of inhibitory neuron, not his own group, to the other inhibitory group neuron inhibits, this process or this term may be we called as disinhibition. Furthermore, we have direct pathway. Cerebral cortex get input from the basal ganglia network and get outputs from the basal ganglia network, which is directly related with the cerebral cortex as sensory motor areas. Furthermore, the cerebral cortex input moves toward putamen, which is the part of serotonin. Corticostriate fibers release glutamate. After the corticospinal fibers secrete the neurotransmitter, the stimulatory from the corpus striatum, as already we know what is corpus striatum. Then furthermore, we go from the thalamus, release glutamate, or maybe subthalamus in both. Thalamus and subthalamus in both, it release glutamate. Substantial glutamate release dopamine. What is dopamine? Dopamine is a neuromodulatory molecule plays several important functions in the brain cells. It consists of organic chemicals of ketocolamin and phenethylamine families. Ketocolamin about 80% in brains consist of dopamine. Furthermore, if you go, there is striatum part of the putamen. Once get excited due to glutamate, will transmit cardiostriatum fibers. The excited or happy putamen gets output from globus. That is the internal release or increase of GABA.
My name is Zishan Raza. I'm studying in first year from State University. We discuss about the disease of the basal ganglia. First disease is the Parkinson disease, the loss of the substantial nigra and the loss of the nigrosubstantial fibers, and the deficiency of the dopamine because there is no dopamine from the substantial nigra and nigrosubstantial fibers. So decrease amount of the dopamine for the stratum, the lack of the pathology called the Parkinsonism. And the next disease is the hypokinesia. Tactic pathways is responsible for the activities, extreme activities, excitation of the cerebral cortex, initiation of the movements, because there is no tactic pathways, the decreased amount of the movements. Next is a tumor, especially the rolling. Now we have a tremor. The specially pendulum tremor is called the tremor. Now we have two type of rigidities. First is a cogwheel rigidity, which is throughout the whole movement, and next is the post-wheel encephalitic Parkinsonism. If there is a person having a virus called the encephalitic, due to this virus makes the damage to the basal ganglia. If Parkinsonism disease happens, follows by the viral encephalitis called the post-encephalitic Parkinsonism. Now we have the iatrogenic Parkinsonism. It is just a side effect of the anti-fascitic drug. The disturbance of the basal ganglia happens, the iatrogenic Parkinsonism. Iatrogenic Parkinsonism. It is just a side effect of the anti-psychiatric drugs. Disturbance of the basal ganglia happens called the iatrogenic Parkinsonism. Then we have the atherosclerotic Parkinsonism. Elderly hypertensive patient can have a Parkinsonism that is called a atherosclerotic Parkinsonism. Then we have the dystonia, that is the slowest prolonged movements, the prolonged muscle spasm, the neck spasm, then goes to the torticular hand and then we have dystonia, the slowest prolonged movement, the prolonged muscle spasm, neck spasm, torticular hand and arm spasm, writer's cramp, eyes spasm, blepharospasm, the eyes are closed.